Okay, great. It seems like everybody has successfully connected, so we'll go ahead and get started. Again, my name's Peter Clark. I am from Senator Shaheen's offices here in New Hampshire. We want to thank everyone for joining us for this discussion today. We're going to jump right into it. A few housekeeping rules before we start. Please keep your microphones on mute if you are not speaking, just so that we reduce any background noise. Also, as you can see, we have several participants that will be speaking today. So for those participants, we ask that you keep your comments as concise as possible so that we can get through everyone in the next hour. I am going to go through a quick roll call of our participants to make sure that everyone is here. So if you could just let me know. We have Tricia Tilley from the New Hampshire Department of Health and Human Services.
Morning.
Morning, Trish.
We have Dr. Dawn Caruso from Cheshire Medical Center.
I'm here, Peter.
Oh, thank you. We have Steve Annan from the New Hampshire Hospital Association.
Good morning, Peter.
Hello. Lisa Henderson from Leading Age of Maine and New Hampshire.
Yes, I'm here, thanks.
Thank you. Do we have Dr. Travis Harker from Appledorf Family Medicine? Okay, I don't see him yet. What about Dr. Dan Wiskowski from Derry Medical Center?
Morning.
Good morning.
Morning.
Dr. Holly Mintz from the Elliott?
Hi, I'm here. Hello.
Do we have Jim Potter from the New Hampshire Medical Society? Okay. Do we have Bobby Bagley from Nashua Public Health? Okay. What about Anna Thomas from Manchester Public Health? Okay, we'll give her a few minutes. And then do we have Jim Richardson from North Country Health Consortium?
Morning.
Good morning.
Jim.
Morning.
And I know Dr. William Gestner from COAS Family Health. I know he may have been a little bit late, he said.
I am here. Thank you very much. Good morning.
Great. Thanks for being here. And then we have a number of people who will be listening in on the conversation. We have Courtney Tanner and Matt Hood from Dartmouth Hitchcock, and we have Senator Aaron Hennessy from Senate District 1 in the North Country. We'd also like to say hello to our many press friends who are on the call today. I will name off the outlets so that everybody knows who's on. We have the AP, Seacoast Online, Boston 25, the Eagle Tribune, NHPR, Manchester Public Television, Union Leader, the Caledonian Record, WCAX, the Keene Sentinel, WMUR, Manchester Inklink, and the Salmon Press. So thank you all for being here as well. So now I will turn it over to Senator Shaheen.
Well, thanks very much, Peter, and thank you all so much for being willing to take time to join me this morning. Let me also recognize from my office on the call, we also have Chuck Henderson, who represents us up in the North Country, Peter Feist, who's in Washington working on legislation there, and Sarah Holmes, who is with me here in the office in Dover. And Sarah Weinstein is also on the call, who is our communications director, and she's there so she can answer any press questions that we might have. So as you can imagine, it's been a very busy week. We all experienced what happened on the 6th last Wednesday in Washington. It was a traumatic event for the country, and I am thankful that there were not more people hurt or injured. It was a sad and tragic loss of life that should not have happened. And as you may know, there are efforts now to hold those responsible accountable, both the people who broke the law and the elected officials, including President Trump. So that is ongoing, and it's not clear to me what will happen, but I think people need to be held accountable because it was an effort to undermine and take over from a duly elected government. So that sort of has pushed a lot of the news around the coronavirus and the effort to distribute vaccines and get people vaccinated to the background for a few days. But as you all know so clearly, we need to do everything possible to ensure that we have enough vaccines for everyone and that we can move forward as quickly as possible. When we passed another COVID relief bill last year, at the end of the year, there was funding included for distribution of vaccines as well as for testing and contact tracing, all a critical part of the response to COVID. And what I was hoping to hear from all of you is what you think, how you think it's going, what more we need to do at the federal level. I think with the new administration, we'll see some changes in vaccine distribution. We've already heard from President-elect Biden that they intend to get as many doses out as possible and not hold anything back for a second dose for the Pfizer and Moderna vaccines. So what I'm really hoping you can share with me this morning is what you're seeing in your practices, in the people you work with, what more we should be thinking about in Washington in terms of supporting you and providing help, and how we can continue to support the state as you're addressing this challenge. So we are going to get some resources from that COVID package. It is not going to be as much as we initially hoped because of the way the CDC has manipulated, and I will say manipulated because I think that's what they've done. The formula for getting the funding out has shortchanged a number of small states, us included, in terms of what we think we should have gotten. So we're going to continue to be working on that, but there is money coming. And I think we got the first 12 million. Peter Feist, correct me if I'm wrong. That is in the pipeline now. And hopefully we will see some more very quickly for distribution administration. So that's my brief update. I'm going to try and keep it brief because I want to hear from all of you this morning. And again, thanks for getting on the call. I look forward to hearing your thoughts and anything that we can do to support your efforts. That's why we're here. Thanks.
Thank you, Senator. And now we are going to turn first to Tricia Tilley from the New Hampshire Department of Health and Human Services to give us an update on the vaccine rollout in New Hampshire. Tricia, I'll turn it to you.
Hi, Tricia.
Good morning. Good morning, all. Good morning, Senator. Thank you for inviting us today to provide a brief update on vaccine distribution. It's great to see so many friends and partners on the Zoom. You know, we all know that stopping a pandemic requires using all the tools we have available. And granted, staters who've been wearing masks and social distancing, businesses that have implemented new processes and policies, healthcare workers who have heroically are on the front lines caring for patients have all helped reduce exposure, but even these measures are not enough. It's such an exciting time to have a safe and efficacious vaccine available. Vaccine distribution is a partnership, and no one organization can take this on alone. DHHS, our hospitals, retail pharmacies, the National Guard, and our community partners have been all hands on deck as we prepare and distribute vaccine and ultimately get it into the arms of New Hampshire residents. Like other states, New Hampshire has been planning for decades on how to distribute vaccine quickly and efficiently in the case of a public health emergency. And now those plans are being tested and modified to meet today's urgent need. The funding that has been made available allows us to do that. Over the past month, over 80,000 doses of vaccine have been received in New Hampshire, and over 50,000 people have received their first dose. These include residents of long-term care facilities, nurses and doctors standing at the bedside caring for patients, and our first responders. Thousands of frontline healthcare providers have received their second dose and are on their way to be fully immunized. The department is publishing a weekly summary of vaccine data each Friday to ensure that our efforts are transparent. So let me circle back and remind folks where we are today. We are still in phase 1A, focusing on long-term care residents, healthcare providers, and first responders. Over 1,000 people register a day for appointments. Those in this first group can now register straight into February for their second dose. Our plan was to have this group wrapped up with the first doses by the end of January, based upon the amount of vaccine that we have received, and we are on our way to meeting that target. Hospitals have provided vaccine to their high and moderate risk staff. CVS has enrolled approximately 75% of the long-term care facilities, and Walgreens is working with the other 25%. And they are working to get all of their clinics completed by the end of January. New Hampshire had then determined that individuals 75 years and older and those with significant medical risk were to start at the end of this month and go through March. Our philosophy was to get vaccine to those at the highest risk for the worst outcomes of COVID with the doses we were expected to receive. Secretary Azar announced yesterday that there are new recommendations. They are suggesting that states consider opening those doors even wider to everyone 65 years and older as soon as possible. We know that there are many in New Hampshire who are excited about that idea. My phone is buzzing, our phones are buzzing with texts and calls from individuals eager to get in line, and we want to help them. The governor and our team are reviewing all of this new information from Washington, and we are awaiting more details about supply so that we can ensure that we can meet this new expectation. We need to better understand the formula that they will use to allocate our doses so we can determine how many appointments we can make and the amount that we can send to our partners, many of whom are on this call today. As you can imagine, the team has been working nonstop to better understand these projections so that we can nimbly adjust our plans. We still need time to operationalize these ideas, and we will have a more formal announcement on how we're adopting those recommendations soon. But the goal remains the same: vaccinate as many people as quickly as possible. We all hope that as we reach out into the broader population, that vaccine eventually will be administered in a variety of settings, including hospitals, healthcare provider offices, through pharmacies, and our state-run fixed sites, much like the one that we have here in Concord, right in the parking lot of the Steeplegate Mall. Eventually, we want this to be as easy as getting your flu shot. Right now, we're focused on understanding the capacity of our community partners to take on some of these challenges while ensuring that the backbone of our state-managed sites continue to be ready to meet the need. And even with a curveball, we remain steadfast in our dedication to get folks immunized as quickly as possible. If there's anything we've learned during this pandemic, it's to be flexible to change. Our partners, hospitals, long-term care providers, community members, and the residents of New Hampshire have truly been extraordinary. We're all eager to take this next step. I think we literally want to roll up our sleeves to protect our families and to protect our communities. And we want those that are most in need to be in the front of the line. We will provide additional information on how to access vaccine as we enter each phase. I think many of us know that DHHS and the state communicates loudly and often, so we're asking you to hold tight as we learn about how we may make some adjustments. So we want you to watch our website for changes. There is a wealth of information to be found there. Our partners on the call today are going to provide the real color commentary on how vaccine distribution is going out in the field. But in the meantime, we encourage everyone to check those weekly data reports to see how well we're going. And most importantly, we want to ensure that everyone will consider this safe and effective vaccine and sign up when it's their turn. So thank you. I will yield my time to the others on the call that can really describe what's going on in the community. Thank you.
Well, thanks very much. And because we have a number of people, I'm going to hold my questions, and I'm sure the others are willing to do that until the end. But thank you. That was a very helpful overview.
Well, thank you, Tricia. And now I'm going to turn to Dr. Don Caruso from Keene for Cheshire Medical Center in Keene.
Thank you, Peter, and good morning, Senator. I want to paint a picture for you because I think it's important to put vaccines in context for what the hospitals are doing, and I'll be short in terms of the pieces prior to getting to the vaccinations. But across the state, the hospitals are seeing unprecedented demand for their inpatient services. Over the last couple of weeks, I would say over the last 10 days, we have truly been at a point where there are a minimum number of ICU beds available. the hospitals have worked in really an unprecedented way, and I think in an unrecognized way by many people, in terms of how we're moving people around the state to accommodate everyone so we can continue the normal standards of care we deliver in this country. And we don't have to move into those crisis standards of care, which is what we're really seeing in California. And a lot of it really has to do with us working regionally together, which we've never really done before, but also as a state. And that puts a huge burden on us in terms of the constant conversations and anxiety that it creates for our staff. At the same time, we're actually staffing all the local clinics that are doing a lot of the testing. We're also staffing the people who need to be seen who don't have COVID. And then really what ultimately happens is we start to vaccinate our employees, which has really gone extremely well, is what I would say. And the staff throughout the organizations here in the state, really everyone is, as we heard from DHHS, at that, most of our highest risk have received their first vaccines. Many of them are now receiving their second vaccines. A good portion of our moderate risk healthcare workers are now receiving their first vaccine. So that's gone very, very well. It is logistically very difficult, and that's really important to understand. We don't know how many vials we will get. We don't know how many doses are in a vial. And so you have to think, we're running a clinic until 7 o'clock at night. You pull out that last vial. You don't have 5 doses. You have 6 doses. You have 7 doses. Who's still left in the building at that time to get those doses? We've done a tremendous job not wasting any vaccine, and I worry this will be problematic as we move through the community phase. One of the things that I think about, and being in Keene, where we kind of are, there really isn't a lot else around us, but I think this is the same throughout the state, is that the hospitals are stepping into a place that really is a public health domain. We don't have a whole lot of public health support on the ground in New Hampshire. It's just the way it is, and the hospitals are willing to step up. But our plea is, as we go down this path, it has to be simple. It can't be complex. The more complex we make this rollout, the slower it will be. We're very willing to do all the things we can do to make that happen, but the more complex the rollout is, the slower that we'll be able to give vaccines to our communities, which we really feel is important ultimately to slow this disease down. And so those are really my comments for the day, and I'm happy to answer questions at the end.
Well, can I just ask for a clarification, Don? And when you say it can't be complex, the simpler the better, give me an example of what you mean.
So when we start getting into, comorbidities, and so what that really requires is someone, whether it's a nurse or a physician, to go into a medical record and determine, does someone really have 2 comorbidities in that age group? That takes time. That takes a phone call. That takes clinician time that now is being utilized to take care of people in health care who need health care. And so that's going to slow the process down. We can put a lot of people on the phone, but now you have to put clinicians on the phone to be able to look in a chart, find the information in the chart, and then attest to that. And so that will slow down the process.
Thank you. That's helpful.
Thank you, Dr. Caruso. I'm now going to move to Steve Annan from the New Hampshire Hospital Association.
Great, thank you. Good morning, Senator. I want to say thank you to you and your staff for all that you've done. You've been incredibly responsive, and we really appreciate all that you've done throughout the pandemic. As Don said, I couldn't be more proud of our hospitals and the healthcare heroes, many of whom I'm staring at right now, who've been on the front lines, every day since the pandemic began. We couldn't thank them enough. And the collaboration that Don talks about is really, pretty impressive, that hospitals are working collaboratively to make sure patients get the care they need when and where they need it. And again, those challenges are going to continue, into the next several weeks and months. And so we're going to continue to do that work again to make sure that all patients are getting the care that they need. As Patricia Tilley said, the goal is universal, and we all share it, which is to get as many people vaccinated as quickly as possible. And we've been working with the department, really from day one to partner to understand how are we going to do that? How do we identify those folks that are most at risk? How are we going to do this? And as we've seen this week, there's new guidance that's come out that's going to help hopefully push more vaccine out to the states. Lots that needs to be considered as part of that. And again, I'll just go back to sort of what Don said, and it's the keep it simple, Steve, philosophy, which is we really just need to do this in as simple a fashion as we can in order to get as many people vaccinated as possible. We've all been struggling with the pandemic for so many months and will continue to do so, but there is hope. There's light at the end of this tunnel, and it really is, this vaccine that is safe and effective. And, the quicker we can get people vaccinated, the faster we're going to be able to move beyond, this pandemic and get back to the things that we all want to be doing. So we're going to need help as to get through this. We appreciate the additional resources and things that are coming from the federal government. We look forward to working with our partners here at the state level to try and make sure that that goal of getting as many people vaccinated as quickly as possible is achieved as fast as we can do so.
Thanks, Steve.
Thank you. I'm now going to move to Lisa Henderson from Leading Age of Maine and New Hampshire.
Good morning, Senator and all. Thank you. I'm Lisa Henderson. I'm with Leading Age Maine and New Hampshire, and we're the Association for Not-for-Profit Aging Services Providers in the state. And so that spans the full continuum from nursing home level of care, assisted living, and even independent senior housing. And so for us, the perspective is all about the pharmacy partnership program. That is the Walgreens and CVS rollout of the vaccine in partnership with the state allocating that vaccine. And, the good news is that those clinics began as early as December 22nd. And as Tricia said, the breakdown of providers utilizing the different pharmacies, that it is more tilted in New Hampshire to CVS, about 75% of providers using CVS, 25% Walgreens. We did a survey with the New Hampshire Healthcare Association and New Hampshire Arts, the Assisted Living Association, last week that was that had a good response rate that we assume is indicative of the about 70 plus assisted living providers and 70 plus nursing facilities in the state, indicating that just about everyone has been scheduled for their first of 3 clinics. So that's positive. The process to schedule those clinics has not been smooth. CVS in particular has struggled a bit to work out a good system of a single point of contact. It's been down to the wire for providers to understand exactly who is included in the clinic, meaning all staff or just certain staff, whether this is nursing facility residents only or also inclusive of assisted living as the state had wanted to see happen, how many doses exactly. So, that hasn't been easy on providers, but when the clinics happen, it is pure joy. You see residents that have not seen each other for some time. And so while they're socially distanced waiting in line, it's a bit of a reunion. The staff, by and large, are eager to receive the vaccine. This is an area of ongoing education that is going to have to continue. And, we as associations and certainly DHHS and CDC nationally are trying to provide good information. But, while we're seeing about 80 or 90% uptake of the vaccine from residents, so very high acceptance rate, for staff, it's hovering around the 60% range, but I would want to put an asterisk next to that because that was for the very first clinic. Not many have had the distance between dose 1 and dose 2 yet to be able to state affirmatively how many of their staff that might have been waiting on the sidelines to see how it went now want to step in line to get their first dose. But we're hearing a lot of positive things that conversation with peers and understanding that you felt okay, maybe a little soreness in the arm, but everything was all right after you received your first dose, I think will help with the uptick of staff acceptance. And, I have to say we're lucky in that I spoke with a colleague of mine who is in my role in South Carolina, and she's talking about staff acceptance rates in the 20% range. So that's alarming. We do have to remember that this is a system of care that is has federal oversight through the Centers for Medicare and Medicaid. I personally am wondering what's going to come next in terms of regulation regarding the reopening process. You can certainly understand that families are very eager to be reunited with their loved ones, but we have a lot of gaps in our knowledge just yet as to how safely and quickly we can do that, and it does depend on a high acceptance rate among staff to feel the most secure about that. So we don't know. I know that DHHS is working on this and trying to delve into this. So more to come on that, but it is something that we're feeling. This obviously pent up desire to return to normal, but it is going to take time. There is one piece to the rollout that, particular to our members, has been a little complicated and confusing, and that is other congregate settings that are not skilled nursing homes and assisted living. We have members that are continuing care retirement communities, and that means on one campus, they have all levels of care, including independent living. And these are in the independent living space, residents that are on average 85 years old and up. So it is an older population, not all of whom are driving anymore. And so we're concerned about what is that process for older adults. One, could they access this vaccine still through the pharmacy partnership program? We're just struggling to get an answer. And there's a lot of finger pointing at the federal and state level. I'm not trying to say in a contentious way, but just confusion about our independent living residents in that particular setting included in the pharmacy partnership program. If they're not, how will they receive their vaccine in an efficient manner? So when you have hundreds of individuals living together in community, there is a greater risk of spread. And so we believe that whatever we can do in partnership with the state and the pharmacy partnership to ensure the efficient delivery of vaccine to residents in congregate settings. I mentioned continuing care retirement communities, but I would also say subsidized senior housing, other places where people live in close community, that if we can do that through on-site clinics and get that done, I don't believe it will be efficient for individuals living with hundreds of others to sign up online or stand in line in their local pharmacy to do that. I think we need a system to do that. The public health networks may be an option for that, but we're just sort of in limbo, understanding who's on first to get that done. So I'll leave it at that.
Thank you, Lisa. And I see Trish shaking her head. So do you have a quick answer to that, Trish, that might help clarify that, or at least to know the process?
Thank you, Senator. Yes. So I wish I could say I could give you the exact process right now. As you know, as we're thinking about these potential changes that we may be addressing in terms of who's in our 1B, there's logistics to be worked out, but I would suggest fully that partnership with our public health networks is a way that makes sense for those congregate living environments, because we agree we can't put them all in a car and send them out to the fixed site over at the Steeplegate Mall. So again, that partnership with our community public health networks, we think, is probably the way to go.
Thanks.
Thank you so much, Lisa. I am now going to move to Dr. Dan Wiskowski from Derry Medical Center.
Good morning, Senator. Thank you very much for the opportunity to be on this morning, and good morning, everyone else. So just as a brief introduction, so I am actually a family practice physician for the last 25 years and the CMO, currently Chief Medical Officer for DMC Primary Care, which is the largest independent primary care office in the state. So we take care of, in conjunction with our internal medicine partner, we take care of about 65,000 people and have close to 70 providers between the two practices. And we take care of many of the patients up and down that I-93 corridor. So, so just as kind of a little bit of history, where we're coming from. So back in March, we with the onset of the news of what is going on in the country, and we're able to very quickly modify our process, put up a tent, create a COVID command, identify key players to have a role as far as getting patients seen, and also creating a system by which we could do televisits as well as within a month reopen our offices. So since April, we've managed to see about 140,000 patient, or have about 140,000 patient visits since April. So we've done an incredible job.
Don't care. Give us some good information.
I'll give you more good information. So, so we actually, we really want to, we would really want to drive acceptance of the vaccine. So we have a great relationship with our patients. And I believe that we can do that as a primary care practice, that we can drive acceptance with our patients. And there's a large number of them that we need to drive acceptance with. I believe that as a primary care practice, that there are a few challenges that we face, right? So like everyone else. So having patients, that's not a challenge. Physical plant is a little bit of a challenge because in order to administer the vaccines, unlike the hospitals that have had a little bit of time to figure out where they're going to do it and how they're going to do it, we've you know, that's been a little bit more of a struggle. How do you do that? How do you bring patients into your office and watch them for 15 minutes or 30 minutes, depending upon, you know, depending upon how long you need to monitor. So, and then I think that the largest, or where we struggle the most is in staff. How do we support this? And this was actually, Don mentioned this, and thank you, Don, I agree. But there's a tremendous amount of outreach that's required whenever you need to contact patients that need a vaccine. So, so as far as getting them into the office, that's going to require additional staff support. So we want to bring those people in, but we need the staff that is able to, you know, spend time on the phone for the people that don't have their iPhone, or, you know, so that we're going to have to place a landline call to them. Just the same challenges that everyone else faces. So I think that that's something that we're going to need to think about in this process. How do we support being able to outreach and contact these patients and bring them in and safely administer the vaccine? So we've been able to test patients. We've been able to build a mechanism by which we can immunize patients for the flu outside. Again, I think I see the major struggle being bringing those patients, you know, in, contacting those patients, the administrative burden of entering all that information into our EMR, and then being able to, giving the shot is the easy part, you know, so, you know, so hashtag take your shot, but that's really the easy part. What we need is we need that support. And honestly, probably some of that's going to need to be financial. I know that the state is getting support to be able to administer this, and they've set up, you know, 13 sites, and that's been, I mean, that's actually a great feat, and I received my immunization at one. So, but, you know, the private practices are going to need support for this. So we're going to need some way to compensate. We charge, you know, Medicare pays us about $14, $12 for an injection. And, you know, so that is not going to cover the cost of bringing 65,000 people into my office. So, you know, that's going to be where I struggle, you know, with this. I can figure the rest out, but that's really where I struggle.
Thank you so much, Doctor. We will continue right along to Dr. Holly Mintz from the Elliott.
Hi, everybody, and thank you so much, Senator Shaheen, for this opportunity. It's really exciting to be entering this new phase of care in our pandemic, and I will tell you that we are very excited. We have had a very successful staff immunization program with Solution Health, which is consisting of the Elliott and Southern New Hampshire Medical Center. We have had acceptance rates of up to in the 60s and 70% range, which is fabulous. And I do believe that there are people who are in healthcare who are kind of maybe waiting a few weeks to see, you know, how the first few weeks have gone. So I'm excited, and I will tell you that it's been an enormous morale booster for our entire staff. I want to share with you, I'm a pediatrician. So immunization, the issue of immunization is very, very close to my heart. I've been working in the state for 25 years, and I also just want to mention and commend the incredible collaborative effort that the state has had, literally often twice, 3 times a day, every day, weekends. I mean, it's really, I've never seen in my time here, which is where I've spent my entire career, so much collaboration amongst the hospitals and so much teamwork. So it's really something that I'm very proud to be a part of for sure, and I think the state should be proud. So regarding the vaccination of the public, we know that people are very anxious. We know people are anxious and excited and want that shot. And you can have a phase of 2 months where people are going to be getting the shot, which really turns into 4 months because it takes 2 months for people to get their first vaccination. I will share with you that, and most of you know this, the people who are on day 1 are really happy, and the people who are on day 5 or day 10 or day 20 or day 90 get very frustrated. We are ready to go. We are very grateful for the fact that the state has offered us the ability to use our own electronic medical record and then transfer the data to the state, because trying to teach our patients how to use a completely different system, I think would honestly be 10 times the amount of work. So the ability to be able to pull the data from our electronic medical record regarding who qualifies for the vaccine, reaching out to those patients, some via the electronic medical record, some by phone outreach, and then scheduling for the appointment and actually documenting the administration will be much, much easier for us and will allow the throughput to be much more effective. Now, we have experience doing mass vaccination clinics. We, in the good old days, even up to 2 years ago, we have done flu clinic for our pediatric clinics, and we've done up to 1,200 patients, kids, in a 4-hour period. So we know how to do it. And obviously things are a little bit different here because we need to ensure social distancing, and we need to ensure an observation period after the patient receives the vaccine, and we want safety to be a priority. We also are going to be very sensitive to the fact that people are going to be very, very anxious to get this vaccine. I think one of the most important things that we will need, because I share Dr. Wiskowski's challenges and all of our challenges across the state with staffing. And honestly, we have positions open that we can't fill because people, as we all know, have limitations to working right now. And so we continually are understaffed, which again, every hospital system and every practice in the state is understaffed. We are going to need to divert resources from our usual care of patients to this vaccination effort. And again, even if I think we opened up 20, 30, 40 new positions and made the investment to hire those people, I don't believe that we would be able to hire them. What we're going to need is patience from the public. So we also are very committed to caring for our patients on a daily basis in all of our practices. And so what we're trying to avoid is shutting down our clinics and not offering that care, because really what that will do is lead more people to the emergency room and cause more of an issue for the hospitals. So we hope to be able to offer a lot of immunizations very safely in a short amount of time using the medical record that we currently use. But what we're going to need to not completely and totally overwhelm our staff is messaging to the public that we need them to have faith in us. We need them to trust us, that we know who they are and we know they need the vaccine, and we will be reaching out to them. We can, again, try to set up hotlines to answer questions, but that's diverting resources away from the efforts that we think are so important. So I think helping us to message to the community that they can trust the city, they can trust their healthcare providers, they will be contacted, they will be scheduled. I think that would be really, really helpful. Even to set up some type of a hotline in the state where people can call just for reassurance, because I think it's going to be impossible for us to completely support that effort. The other thing that we have talked about in Solution Health is not only reaching out to the patients that we have in our primary care networks, which in total is approximately 200,000, but if we also include data on the patients who see our specialists, we may be able to capture and help the private practices in immunizing some of their patients within our clinics, because many of the private practice patients in the community who are high risk are seeing our cardiologists, our pulmonologists, our oncologists. And so we would really like to create a community effort where we help to vaccinate those high risk patients by using the data that we have within our system, not only for our primary care patients, but our specialty clinics. I'll share with you though, everybody is excited. Everybody is willing. I have had multiple emails from my providers letting me know that their wives or husbands are interested in volunteering, that, we're going to ask people to help, kind of manage the safety of the patients on the weekends. I expect a really positive and all-inclusive effort with this vaccination project. And like I said, we've done this before, not on this scale, but we have experience delivering a lot of vaccines very quickly. And there are obviously, as I said before, complicating factors that we need to consider, but we are fully confident in our ability to be able to help the state and to help our patients receive this vaccination.
Thank you, Holly, and all of the reporters who are listening in. Hopefully you got her message about trying to help share with the public confidence that they are going to get immunized and things are going to move as fast as everybody can make it move.
Yeah, that's good.
Thank you, Dr. Mintz. Just a time check, it is 10:45, so we have about 15 minutes left and still five speakers. So just if we can keep our messages concise so we can get through to everyone, we're going to move to Dr. Gestner from Coas Family Health.
Good morning, actually. I'm Bill Gestner. I am the Chief Medical Officer of Coas County Family Health. That's the county in the northern part. If you haven't seen it or visited it, please do. Until this last surge, actually a couple months ago, we were blessed with very few cases. And I'd say we were blessed because we didn't have many. Now, as you know, we've been tipping the scale a little bit. I'd like to thank the Senator for her support for primary care and the community health centers and her recent help in securing our future fiscally. But I think we're facing this significant issue now with COVID-19. The Coas County has about 33,000 residents, and we service about a third of them at Coas County Family Health. And there's a community health center in Colebrook as well as in Lancaster with the Rural Health Center. And so we're all in the same geographic area together. We service the same sort of patient population. And but there have been challenges with this rollout, and my colleagues have just stated that some of the issues that have come up in terms of staffing, some of the fiscal issues, as well as some of the logistical issues in administering this vaccine as opposed to a flu vaccine. We've done here at Coas County Health, we've participated in drive-through clinics for flu vaccines. We are currently testers for testing PCR and antigen testing with a drive-through situation here at our practice sites. But one of the rate limiting factor for us has been the acquisition of vaccine currently. That has been something that we've been struggling with. We actually have two nurses who are testing people in full garb to protect themselves who have not received the first dose of the vaccine. We've only had 41 of our 140 staff members that have been able to receive the first dose. And so that sort of is a real difficulty for us. And I have to pay respect to Jim Richardson and Chuck Henderson from your staff, Senator, who have been very helpful to us. As they know, and perhaps you know, we have a community get-together that we 3 times a week for an hour, where we talk with community members, the representatives from the school systems, representatives from visiting nurse, the visiting nurse associations, the public health people, the school superintendents, this and the hospital personnel. And I might say that the hospital has been very much dedicated to us with sort of codependence, if you will, in this community. We have been working with AVH closely for years, and we continue to do that. And as Chuck and as Jim know, we are committed to the vaccination of our population, those who we see as patients and perhaps those we don't, just to make sure that people get vaccinated. So getting the vaccine has really been difficult for us. We've had, even our staff has found it difficult with the current VAM system to get the vaccine. And it certainly is difficult for our patients. Our patients swarm us with calls about what to do. You know, how I've tried to, and those people who are classified as 1A are, you know, have had difficulty. And I know that system is changing. And that brings us to another spot. We have a bit of a moving target, don't we, with respect to, are we going to stick with these current phases, or what's going to be the emphasis and who's going to be next? And we're confused about that. And I think all of us are looking for what sort of practical guidance is going to come forth with the larger populations that we'll be seeing. We're certainly committed to vaccination. Primary care, I think it does it the best. From pediatrics to family medicine, general internal medicine practices, whether they are community health centers or private, they, you know, part of their lives are dedicated to vaccination of their patients. So these are the sorts of things that we're doing. The partnership with the hospitals has been absolutely superb, and will continue. We will continue with working with our partners and other partners to help with this particular process. The issue of space in terms of how to increase our numbers, that's one we're still working with, but, you know, whether it's a drive-through, whether, you know, how, because it will take 15 to 30 minutes for people once receiving the dose to wait around in case they have a medical emergency, making sure EMS is around. And those sorts of things are real practical things that we're dealing with. Not only, as Dr. Wasikowski mentioned, making sure that the EMR is working up to snuff and we can use our EMR to communicate with the state. We are all getting ready or working to try to reduce that vaccine hesitancy that Dr. Mintz had mentioned through local means, through our paper, through telephone messaging. We have, if you punch 3 on our dial, if you're calling about COVID testing, we'll tell you we don't have the vaccine, and we'll get back to you and try to assuage people's concerns. There are lots of things that we are doing, but I really think we need some more vaccines out there, and we need some guidance about what's going to happen in the next couple of weeks or so. So I'll stop there, and I'm sure my colleagues will fill in the gaps that I might have missed in this effort. Thank you very much.
Well, thank you, Bill, and rest assured, I get regular updates from Chuck on your weekly calls, and he hits all the high points. So I hear what's going on a regular basis.
Thank you very much.
Thank you, Dr. Gestner. We're now going to move to Anna Thomas from Manchester Public Health.
All right, thank you, Peter, and thank you, Senator Shaheen. And I'm a fast talker, so I'll get through this fairly quickly, hopefully. So I want to just quickly brief you on, we're sort of in the midst of trying to still respond very heavily to the pandemic while trying to pivot to the vaccination strategy. We are the epicenter in the state of New Hampshire, as you know, for COVID, but not just COVID, for lots of other conditions. We have 110,000 residents who live in this community who were already experiencing different levels of poverty going into a pandemic, over 35,000 people living at some level of poverty. I think those factors are very important because the other piece of this planning that has to be rolled out is consideration for the populations we serve. So we're an urban center, and I don't want to speak for Nashua, but certainly Nashua and Manchester, we've had our lion's share of the COVID response. So as a local health department, we've been in place for 180 years. We have been responding 7 days a week ever since the beginning of the year to this pandemic. We've had over 7,000 cases of COVID in the city of Manchester proper. Unfortunately, more than 170 deaths and at least 15,000 close contacts who we actively monitor as a local health department. The other feature about us is that we have all of the school nurses under our umbrella. And a lot of people don't know that we have 22 public schools in the Manchester School District, making us the largest school district. But the fact that we have school nurses under a local health department really affords us a different reach and a very real-time response to what's happening. So those school nurses are actually doing all of the case investigation and contact tracing with our children and families, boots on the ground. So we have really worked very hard to be as responsive to the needs of the population. So my concerns for vaccination is really, as we partner together as states and local communities and certainly healthcare delivery systems, I think this begs a bigger question, maybe after the dust settles, about what does the local public health infrastructure look like as we move forward? Because I think there's been a lot of questions that have been raised about jurisdiction, who has the legal authority to act, where does someone start and end? And there's a lot of blurred lines. We have public health networks, we have 2 comprehensive local health departments who are governmental authorities to act. And I think when it comes to response, we're still trying to figure out how we all work together and where we start and end. So we've been running the testing site for this city, and we've been able to administer over 100,000 tests to the population. We would like to use those sites eventually to flip those to vaccination sites. And we have multiple places in the city where that is highly conducive. We're kind of waiting in the wings for when that will be activated. And we want to see ourselves as part of that solution. In addition to that, I think the kinds of things we have to think about, though, is what does New Hampshire actually look like? And how do we best meet people where they're at? So for our community, being the most diverse community, we need things that are culturally effective. We need things in multiple languages. We need things done in a way that reaches populations who wouldn't normally have access to a traditional healthcare delivery system. We unfortunately have a significant homeless population and a vulnerable population that is highly transient. And I think those are other layers of how are we going to get, if we want to achieve herd immunity, how are we going to get to everyone equitably? And I think those are larger scale plans that might be unique to the urban areas, but I think they almost need to be elevated because we disproportionately represent the population. We've disproportionately represented COVID. And I think we would rather be sort of ahead of it in our planning efforts than try to be so responsive. And so I would just ask for, to be more, apt to be available to those planning conversations earlier as we're kind of on a need to know basis. And I would like to see those kind of floodgates opened up a little bit in communication so it allows us to prepare and plan. And certainly we want to be able to do everything we can to help the state, help other communities. We are, the cities of Nashua and Manchester are, always in communication with each other because we have so many similarities in being urban areas. And we have bandwidth between the 2 cities. So we're really just trying to do our part and be informed as possible and really be mindful of the needs of the population, because I think the vaccination strategy has to kind of start with what's happening in these communities and then be brought upwards. So I'll stop there.
Thank you.
Thank you so much, Anna. And now Jim Richardson from the North Country Health Consortium.
Thank you, Senator, for the invitation today. And I'll be really brief. I do work with Dr. Gestner and Chuck Henderson up in the North Country. I am the Public Health Emergency Preparedness Coordinator for the North Country Public Health Network. As you all know, we cover over 3,000 square miles of the state. So even though we only have 3.8% of the population, we have over 30% of the geography, which has its own challenges. So what I've been working on really with my partners since last March is to try to build capacity as the state rolled out their vaccine strategy around the fixed sites in New Hampshire. So I can say that very successfully, and as is typical in the North Country, our partners have stepped up tremendously. So we've actually developed 5 different locations within the North Country, in addition to the fixed site in Littleton that the National Guard operates, to be able to provide COVID vaccines to our Tier 1A folks. And those clinics are going on as we speak. And I would just like to say that I'm very appreciative for the towns of Gorham and Lancaster, Littleton, Woodsville, New Hampshire, and Upper Connecticut Valley Hospital with the 45th Parallel EMS. They are conducting these clinics for our Tier 1A public safety and healthcare workers that are most at risk currently, and they've been doing so for the past few weeks. So that partnership is working extremely well. We are supporting that with the vaccine that comes into our North Country. And we also provide that vaccine to the National Guard fixed site in Littleton as well. So we're partnering with our state agencies, Homeland Security and Emergency Management, DHHS and DPHS. Some of our challenges that we have, as you know, is we have no interstate highway in the North Country. We all have secondary and tertiary roads. So when we looked at this strategy that we developed, in addition to the state strategy, it was really around the fact that we have very limited access to transportation. And if you look at somebody coming from the town of Pittsburgh, to ask them folks to drive all the way down to Littleton, it's a 2.5-hour drive. So we really determined with our partners that it was better to operate these mobile clinics, as they're called. We call them closed pods, closed points of dispensing. Some of the challenges we've had is funding. As you've heard already on this call this morning, we are a nonprofit agency that operates the public health network. And funding has been an extreme challenge as we try to build out our workforce to be able to respond to this COVID pandemic. And then also, as Dr. Gestner indicated, we have a challenge with availability of vaccines. So because as the vaccine comes into the North Country, it is split, the allocation is split between the fixed site in Littleton run by the National Guard. That clearly has a better throughput per day than we do at the regional level. Our doses requested from these 5 closed pods that we operate is always exceeds the doses that we get. And we never know from week to week how many doses that we get. So if you can think of it from a planning perspective, it's extremely difficult to plan week to week when you don't know what your allocation is. So that's been a challenge for us. I can tell you that DHHS has been very flexible with us. We have had some last minute requests for a vaccine. And so far that has gone good, but from a planning perspective, it's really challenging on not knowing how much you're going to get. And given that, we all realize that our allocation into New Hampshire is not what we were hoping that it would be. So I would just like to thank you for the opportunity to speak to that a little bit. I'm extremely excited and happy with the uptake numbers that we're seeing in the North Country, and all of the collaboration with our facilities and our partners up there has been tremendous. So thank you.
Thank you.
And last but not least, we have Jim Potter from the New Hampshire Medical Society.
I think we've added a couple of people, Peter, as well.
Okay.
Peter,
Travis.
for crunch, I will defer to Dr. Harper or others. Let me make 3 quick points. One, I want to concur with all a number of the comments that I've already made. Let me focus on 3 things. One, I want to agree with Dr. Wasikowski. We need increased federal support for the distribution of the vaccines in private practices, in urgent care settings, and every other non-hospital kind of setting that wants to be a partner with the state is going to need some help. And we think it'd be probably most appropriate through the federal government. So that's my first request. 2, again, it's been an incredibly collaborative effort with the state. That's the key going forward, to help, it's been mentioned by a couple others, to telegraph what is the allocation phases to these key partners. To do that, we have raised over $100,000 and have convened a COVID vaccine alliance that meets once a week and has various staff from DHHS coming through and talking about the allocation and communications phases. And we're really starting to shift not only to the allocation, but communications and how we can get that out, how we can provide influencer guides, other things as this moves forward. So the way I look at this, I think in February, we're going to be transitioning, gearing up for those public. I'm hoping that new entrants into the vaccines, AstraZeneca and Johnson & Johnson, they're going to schedule to apply later this month. And I think perhaps we'll see greater supply in March moving forward if they're successful. So the important thing is this vaccine distribution allocation policy and communications will change over the next 6 months. And we'll try to keep adapting, keep collaborating with both the federal and our state partners and everyone else in state as this moves forward. Thank you.
Thanks.
Thank you. And Dr. Harker, I'm sorry I didn't see you join. So we'll give it the floor to you.
Thank you very much. I'm sorry that I was a few minutes late. I was with patients, so I spend half my time as a family doctor, and the other half I lead Appledore Medical Group, which is a 160 provider group that takes care of patients in Portsmouth, in Rochester, and Derry. We are the employed providers associated with HCA. And we are multi-specialty, and we've been really working hard to get our communities tested. And over the past months, we've done nearly 8,000 tests of COVID tests for our patients. So we're really proud of that work. We've worked really hard also with our hospital partners. We work with Portsmouth Regional Hospital, Parkland Medical Center, and Frisbee Memorial Hospital. And they were our biggest partners in getting our providers and staff vaccinated. And we've had an 88% uptake on the vaccine by our providers and staff. So 88% of our team will be vaccinated with at least their first vaccine by Friday of this week. And many of them will have had their second shot. So we're really proud of that work. It's really been an effort to communicate kind of at the ground level with our providers and staff so they understand what the vaccine is and how it can be helpful to them and our communities. And so we've had an incredible uptake, and I'm really proud of that work as well. One of the things that's been challenging for us is kind of knowing what this next step is with our patients. We probably field at least 100 calls in most of our primary care offices a day from patients wondering when they're going to be next to get the vaccine. There have been, I think, a couple miscommunications at the state level indicating that people should call their primary care doctors to get more information about vaccination. And we just haven't had that communication to us yet to know what we should be telling patients besides wait, or that we recommend you get it when it's available, but we don't have any details. And so getting a little more granular on the details and communication better with primary care would be a really important step for us to be successful in this next phase of things. I think the other thing that would be important for us moving forward is a really clear process on how we were going to do attestation for the 1B patients, people who are over 75, or people who have diabetes, or people who have Down syndrome, all these different conditions that are on that list. I, as the leader of a 160 provider medical group, have not received any communication on what my responsibility with my team will be to do that. And I just, right before I joined the call, I had a patient asking me if they would be eligible. And I said, probably, but I don't know the process. And so understanding that would be helpful. I do think that if it's a bureaucratic process where we have to kind of log into a website and for every individual patient and get them signed up, that's not something that primary care can do. Our primary care providers are carrying a huge burden. And it seems like when there's a deficit in the healthcare system, it comes back to primary care, because we are kind of a universal Swiss Army knife in healthcare. We can do a lot of different things. We help plug gaps with mental health. We've done a lot of the testing, and we want to be part of the solution, but we really need to be at the table talking with the state on what's going to make sense for our operations so that we can make things happen in a smooth fashion.
Well, thank you. I think we heard that concern from a number of people who have spoken this morning, and I appreciate that. I think it goes to Don's point. In the very beginning, the simpler is better in terms of how to make decisions about vaccinating folks. And I'm sure that Trish has taken notes on that, so she knows how people feel. I know that we're out of time. I think we got everybody on the call, and unless did somebody call in or register that we haven't heard from? Okay, if that's so, speak up now. But what I'm hearing loud and clear that you all need is more resources, which we are continuing to work on at the federal level. And please share with us any particular instances or specific ideas that you think might be helpful, or arguments that we can use as we're trying to make this point. The other thing I've heard loud and clear is that guidance and better information about how much vaccine is coming to New Hampshire is really important. And I know that that's an issue that the state has as well. And so we are going to be doing everything we can at the federal level to trying to urge more information for people. Obviously, the more vaccine that's available, the less that becomes an issue. But to try and push that and make sure that you're also getting whatever guidance you need at the federal level for the state and for you as local practitioners is really important as well. So we will be pushing that, and I hope you will share with us, with Peter Clark, with Peter Feis, Sarah Holmes, all of the folks who are on this call, who any thoughts you have that you think will be helpful to us, please share those. And don't worry about having it be something that's obscure or you think it may not be germane. Share it anyway, because as we're starting, as we're starting another appropriations process, the more information we have to try and help get the resources we need better. So again, thank you all so much for being on the call this morning, for everything that you're doing to try and address this pandemic. I know it's not an easy time, but as several of you have said, things are looking up. Help is on the way. So the more efficient we can be with these vaccines, the better, and the more people we can get immunized, and we're here to help you do that. So thanks very much.
Thank you, Senator.
Thank you all.
Thank you, Senator.
Thanks.
Thank you, Senator.